Life always throws us hard battles, and this is nothing new. There can be many ups and downs in a person's lifetime, and even the calmest person may not be able to manage anxiety properly. People tend to take certain medications to treat anxiety or try alternative medicine such as CBD products or medical cannabis as an effective treatment for anxiety-related disorders. For this reason, the debate about using CBD versus THC for anxiety comes up a lot. Hi guys! Welcome once again. So, in this video, we are going to explore the topic of CBD and THC for anxiety. Let's find out which cannabinoids are best for managing anxiety. We'll also explore the pros and cons of using CBD versus THC for anxiety and depression, the key differences between the two, and how they affect a person's ability to deal with stress and anxiety. First, let's consider the main causes of anxiety disorders. Watch till the end, if you are curious. Occasional anxiety is a normal part of life. However, people with anxiety disorders often have intense, overwhelming, and persistent worry and fear about everyday situations. Often, anxiety disorders involve repeated sudden feelings of intense anxiety and fear or terror that reach a peak within minutes. This anxiety and panic interfere with daily activities, is difficult to control, is out of proportion to the actual danger, and can last for a long time. You may avoid places or situations to avoid these feelings. Symptoms may begin in childhood or adolescence and persist into adulthood. Examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder, specific phobia, and separation anxiety disorder. You may have more than one anxiety disorder. Sometimes anxiety is caused by a medical condition that requires treatment. No matter what type of anxiety you have, treatment can help. A variety of reasons can lead to what is known as a generalized anxiety disorder for many people. However, one thing remains constant at every level: dealing with anxiety can be challenging, and those who suffer from it will do anything to relieve the anxiety. Anxiety disorders such as social anxiety disorder, panic disorder, or post-traumatic stress disorder can be debilitating. It can also create several physical health problems such as muscle tension, headaches, increased heart rate, and many mental health conditions. Before we dig deeper into the worlds of CBD and THC for anxiety, let's discuss some of the main reasons people get anxious. Anxiety is caused by the neurotransmitters in the brain experiencing some kind of imbalance at the chemical level. These may be inherent chemical imbalances, or they may develop over time as you cope with certain experiences. Some of the more common neurotransmitters that have a direct link to anxiety responders are dopamine, gamma-aminobutyric acid, serotonin, and norepinephrine. Both CBD and THC are effective in helping with anxiety. If you want to feel that high, stick with THC to help with your anxiety. If you want a non-narcotic way to help your anxiety, stick with CBD. In our opinion, CBD is better than THC for helping with anxiety, because you don't get high, which can further upset your anxiety levels. More than 100 different cannabinoids have been found in the leaves and flowers of the cannabis plant. The two most common cannabinoids used in medicinal cannabis products are CBD and THC. From the same class of molecules, CBD and THC work differently. THC can be used to reduce symptoms such as nausea, vomiting, pain, and muscle spasticity, as well as improve sleep and appetite. In some people who take too much, THC can cause a high typically associated with recreational cannabis use. CBD does not cause a high and can reduce the unwanted side effects of THC. Cannabis and marijuana are terms often used interchangeably, but they have slightly different meanings. Cannabis is a type of plant that contains two main components, THC and CBD. THC, or tetrahydrocannabinol, is the primary psychoactive component that makes a person feel high. CBD, or cannabidiol, does not produce the high-inducing effect that THC does. Marijuana is a specific type of cannabis that contains high levels of THC, which can have different effects on stress levels depending on the dose. THC can reduce stress in low doses, while higher doses can cause panic, confusion, and anxiety. On the other hand, CBD has been shown to reduce feelings of stress and anxiety at all doses. CBD is not considered marijuana, so it is legal to sell it online and in stores. CBD has been shown to have positive effects on stress and anxiety, and in many cases is a better option for someone looking to relieve their stress and anxiety than marijuana. researchers and healthcare professionals have yet to establish standardized dosage recommendations for CBD treatment. In a 2019 study, researchers found that 300 to 600 milligrams of CBD significantly reduced anxiety symptoms in 57 older men. The ideal dose for a person to relieve anxiety depends on the CBD product, how they administer it, and personal health factors. CBD administration methods include oil, sublingual spray, pods, edible, vaporized oil or cannabis flowers. The method of administration determines how quickly the cannabinoids begin to take effect. The effects of orally administered CBD, such as oil, edibles such as gummies, or capsules, usually begin to work within 30 minutes to 2 hours. Smoking or vaping CBD oil or cannabis buds produces more immediate effects. People can use oral CBD products to relieve anxiety throughout the day. Taking these products with breakfast helps. Smoking or vaping CBD oil can provide instant relaxation and help people during particularly stressful events, such as giving a speech. CBD is relatively safe and well tolerated by the majority of people. The authors of a 2017 review of trusted sources confirmed that people can tolerate CBD well, even at doses as high as 1,500 milligrams per day. There are some side effects associated with CBD. These include sleepy, appetite decreased, diarrhea, changes in weight, dry mouth. Before taking CBD products, people should consult with their doctor. CBD is not suitable for pregnant or lactating people. There is also a risk with certain medications and supplements, such as blood thinners and liver medications. It is important to consult a healthcare professional before taking any CBD. People should note that the Food and Drug Administration trusted source does not regulate CBD for the treatment of anxiety or other mental health conditions. People should use their best judgment when purchasing CBD products. Buy products only from reputable manufacturers and distributors. The legal status of CBD is still evolving. At the federal level, CBD derived from hemp plants with less than 0.3% THC is legal, but CBD derived from marijuana plants is illegal. That's because growing marijuana plants is illegal under federal law. CBD must also be produced under specific conditions. For example, the grower must be licensed and follow federal and state regulations. States have legalized CBD to varying degrees, but some still have restrictions on growth, sale, and possession. It's best to check your state's laws. While many people report positive effects from using marijuana to cope with stress and anxiety, it is not recommended for everyone. People with diagnosed psychiatric disorders, such as depression, anxiety, or bipolar disorder, or those with a family history of psychosis should not use marijuana, especially THC-containing products, as it may exacerbate symptoms or lead to risky decisions. Marijuana can also be risky for people taking certain psychiatric medications, especially benzodiazepines, because marijuana can exacerbate side effects such as sedation. However, for those dealing with social anxiety or stress related to life events, CBD may be a viable option. Marijuana is really only recommended for people who experience chronic stress, and even then, it's not going to work for you. CBD, however, is a proven remedy for almost everyone and is a much safer option. When purchasing marijuana or CBD in any form, it is critical to purchase from a reputable business, such as a dispensary, to ensure that the products are properly labeled and not mixed with other ingredients that should not be included. Although they are not yet regulated by the FDA, safe and controlled CBD products can also be found in many health food stores, grocery stores, or pharmacies. Current evidence indicates that CBD has significant potential as a short-term treatment for multiple anxiety disorders. Further studies are needed to determine its use for long-term treatment. CBD was originally found to reverse the anxiolytic effects of THC when used together. However, it had no effect on anxiety when used alone at the doses given in these studies. It showed comparable efficacy to ipsipirone or diazepam 10-11. CBD reduced anxiety in patients undergoing a single photon emission computed tomography imaging procedure in both healthy adults and adults with social anxiety disorder. A recent review found that different studies do not agree on one universal dose of CBD oil that everyone should take to treat anxiety disorders. Instead, it emphasized that different people respond to different doses of CBD oil. The dose of CBD oil you should take depends on a number of factors, including your weight, the condition is being treated, the concentration of CBD in the product. However, few commercially available CBD products contain enough CBD to replicate the therapeutic effects seen in clinical trials. It is important to talk to your doctor about the appropriate dosage and possible risks before starting CBD. Generally, it is best to start with a small dose and gradually increase it until the desired effect is achieved. Thank you for watching. Follow for more.